Hello there, my name's Alfredo Melero, and I'm here to talk about my project. It has to do with the cleaning of aseptic gowns, and let me give you a quick introduction. So, what is an aseptic gown? Well, an aseptic gown is this protective layer worn by healthcare professionals, and it's used to prevent cross contamination or infection. So, if you're dealing with a infected patient, it will protect you, and it will also protect patients given the chance that you are infected and don't know about it. So why would we need to automate this? Well, due to the high number of cases related to COVID-19, the use of these gowns are more essential than ever, and the use has also risen. And once the doctors are done with it becomes a biohazard. These gowns are highly probable to contain the virus on top of them, and it could be a risk for cleaning workers to manage and use their traditional means to disinfect these gowns. So why are we doing this? Well, I had the idea while I was working at Pfizer. These are techniques used to prevent the cross contamination of human products like flakes on the skin or hair to medicine that's going out to patients. And I thought that this could also be applied to the healthcare professionals who are working out there right now to fight the spread of COVID-19 and helping those who are more in need. So, how will automation impact the workers? Well, for the people who are using the gown, there'll be zero impact. The gowns will be there readily accessible at any time that doctors need them. The cleaning staff will not be exposed to the contaminated gowns. So they'll still be there, they'll still be doing their job, folding and packaging. It's just that the pre-decontaminated gowns will be cleaned automatically. So it'll separate them from when the gown is actually contaminated. So what are the benefits of an in-house automated cleaning procedure? Well, what hospitals and manufacturing facilities usually do is they'll get together all these gowns and they'll ship them out to some laundromat, and the laundromat will do the cleaning and then ship them back to wherever they need to be. So if a few resources are moved and it's used and the cleaning is moved to in-house, the gowns will be more readily accessible and be easier to manage this valuable resource at this time. So where will this take place? Well, right here I have simulated a hospital ring where contaminated patients are being treated. Imagine that the green square is where the contaminated patients are. It's an emergency room. And the brown to gold rooms surrounding them are where the healthcare professionals go in, get their gown up, and get ready to go into the emergency room. So let's imagine that a doctor or a nurse is that star. Let's see the path that might take. So he goes into the gowning room, gets ready, puts the gown on, gets protected. Goes into the emergency room, does what he needs to do with the patient, then leaves into the degowning room, takes off the gown, leaves it in a chute so that the automated cleaning procedure can start. So what's the problem? Well, healthcare workers are using these gowns to prevent infection and at a higher quantity. And how can we reduce the risk of cross-contaminating other workers, and having these gowns ready accessible? So what we're going to do is we're going to automate that disinfecting and cleaning process. So how can that be done? So this is one of my first designs. Imagine that this conveyor, that this system has two parts. It has the infected area and the non-infected area. So everything before the washers, the chutes, the conveyor number one, the motor with the relay, everything that is a hazardous zone that nobody should be there. It's a potential risk of contamination. After the washers are done with their job and you move to the second conveyor belt, that's when people could come and touch the gowns and clean them. So how would this work? Doctor would go into the degowning room, throw the gown into the chute, conveyor would take it, the motor with the relay would decide to which washer it would go. Then once enough gowns are in each washer, well, the process might start cleaning and the conveyor stops. Once the washer is done, it opens up from the other side, and the gowns keep moving to the second belt, and they go to a packaging area. So this is my second design. Instead of using a motor and a relay to pick to which washer they go, this design better implements the two types of gown that they are. Because there's an outer gown and an inner gown, and both of them have to be washed at a different rate. So if the outer gown is the first one to come in, the single action piston will push it to the first washer. If the second inner gown is the one that comes in, it will skip the first action piston and go to the second one and into the second washer. So what are the decisions that this program has to take? Well, first is the type of gown that enters the system must be identified. So the healthcare professionals use two gowns, the outer gown, which is the most contaminated, and the inner gown, which is the one they use as a second layer of protection. Both gowns have their own path because they have different times for washing and different conditions that they have to be disinfected in. The second decision that has to be made is the washer needs to contain a certain amount of gowns for the wash cycle to start. You're not going to wash every gown individually. So an up counter must be activated in front of every washer to keep count of how many gowns are inside the washer so it may start the process. So what kind of sensors are we going to use in this automated system to keep the system informed of what's happening? Well, we're going to use an inductive sensor to see which gown is the outer gown, which gown is the inner gown. Outer gowns are usually bulky, they're bigger, they're one piece, and they usually contain a metal plate that will help identify the outer gown. So an inductive sensor will go that, get the magnetic field, send a true signal out, and then it will redirect that outer gown into the first washer. If it's not an outer gown, an inner gown, they're usually all cloth, no metal plate. It'll give a false signal, and then it'll redirect it to the second single action piston, which will take it to the second washer. So a reflective sensor can be used for the chute at the beginning in the degowning room. So it tells the system that a gown has entered it and it starts the conveyor. And a through beam sensor to keep an accurate count of how many gowns are going to be inside of the washer. So what are our actuators to get all these things moving? Well, we're going to need motors for conveyors, keep them going. We're going to need single action pistons that are going to get the signal and push the gowns into the chute so they go into the washer. So we're going to need motors for washer doors. There's 2 doors per washer, and they need to open and close. So we'll also need some relays for that. And lights for each washer to let know the workers that the machine is in the middle of the process. So right here you can see my final design. And I have this small table at the side so you can identify what's a sensor, what's an outer gown, what's an inner gown, what's a light bulb, and what's a single action piston. Let's look. I want you to focus right now on the right side of the degowning room, and imagine that a doctor has just come out and he's taking out right now his outer layer. So what would happen is he would throw it in the chute, the sensor would activate, the conveyor would start. Then he would take out his inner gown, throw it in the chute, then the sensor would also activate and the conveyor would start. As we can see also, in the first block of the conveyor, the inductive sensor has detected that the sensor, the gown that's in it right now, inside of the process, it's an outer gown, and that's why it shined green. So right now it's going to take it to the first part, and then shoot it to the first washer. Boom. And the through beam sensor has sensed that a single gown has gone into the washer number 1, and it has added 1 to the counter. So the second thing that happened is that the inner gown has gone into the inductive sensor area, and the sensor has not turned on. It has given a false signal. So right now it's going to go to the second chute, and that single action piston is going to push it into the washer. So imagine that happens about 40 times, and each washer is now full. So the counter has reached its preset value. So what's going to happen? The doors are going to close, and the process is going to start. See, the light bulbs have turned on, and the washing has continued. Once the washing and drying has finished, the second doors will open, and each gown will go on the second conveyor belt level and go into their packaging areas. Yeah, so that's the general overview of my project. If you have any doubts, feel free to ask me. I'm going to quickly go over everything again here in the final design so we can see it again from the start. Okay, thank you.